day and welcome to the Triage Cancer webinar series. Today's topic is post-election advocacy, getting engaged. Today's webinar will be presented by Monica Fawzi Bryant. Monica is a cancer rights attorney and the co-founder and chief operating officer for Triage Cancer. Throughout her career, Monica has provided hundreds of educational seminars, written articles, blogs, and co-authored a book published by the American Bar Association called Cancer Rights Law, an Interdisciplinary Approach. She also teaches a law school class on cancer rights. Monica, I will let you take it away now.
Thank you so much, Shelby, and thanks to all of you for joining us today to talk about advocacy. I am actually delighted to be providing this presentation today because really at its core, Triage Cancer is all about advocacy. Really, we believe in the ability of individuals to change the systems, institutions, programs that impact our daily lives. And there's lots of different definitions of advocacy. I happen to like this one because I think it is the broadest and applies to so much, but really what we're talking about at its core is about speaking up. And there are lots of different venues or areas or types of advocacy. And when we talk about the spectrum of advocacy in cancer, we're talking about the various ways that individuals and organizations can work to support patients, influence policies, and ultimately improve care. So it can certainly range from personal support all the way through systematic change. And ultimately, the goals of these advocacy efforts are to reduce barriers to care and raise awareness and prevention and ensure that patients are getting what they need, all of which ultimately improves outcomes and quality of life for individuals who are diagnosed with cancer and their caregivers. So by engaging in the spectrum of advocacy, it really plays a vital role in improving care. Interestingly enough, while cancer is not a partisan issue, it can be a political one in the way that laws and policies and regulations can impact the community as a whole, and certainly the individuals that make up that community. And I know there's been a lot of changes happening and lots of information in the news on a daily and hourly basis. And it has caused some confusion, and people have even expressed to us that it's causing a lot of anxiety, particularly around some of the uncertainty. And certainly, I think all of those feelings are valid. The goal, though, for today's webinar is to provide some practical information on where and how advocates can engage in the process to respond to things that are of a concern to them. So when we talk about community advocacy, there are lots of different layers to this. And I think that many of us are probably engaging in community advocacy and maybe just aren't calling it that. But certainly anytime you are helping members of your community, you're sharing information, even if you are just spreading the word about a new program you potentially learned about, you are engaging in community advocacy. And I think that this is becoming increasingly more important given the amount of information that is floating out there and the variety of channels through which we are getting information. Sometimes there's some misinformation. So to the extent that you can help dispel myths or help people understand, be able to separate fact from fiction, that can be really useful in a community. And then there's policy advocacy. And this often gets confused with legislative advocacy, but they aren't actually the same thing. Because policy advocacy is around working for some sort of change or supporting a particular policy. Now, that could lead to legislative advocacy, but it doesn't always have to, because it could be about advocacy in places where legislation maybe isn't occurring, like with an employer or a school or a hospital system. So maybe it's about a healthcare provider working with their hospital to change its policy on how they're going to fill out medical certification forms for FMLA or reasonable accommodation requests. It could, though, also be around advocating with agencies, whether those be federal or state agencies, to change or retain a specific policy or regulation. And we're going to talk a little bit more later about how you actually go about doing that by writing comments on agency regulations. Which of course brings us to legislative advocacy. This is about working to achieve some sort of legislative outcome. So this could be getting a member of Congress to introduce a new bill on a specific topic, like requiring insurance companies to cover reconstructive surgery after a mastectomy. It could be asking the governor to increase funding for early cancer detection screening in a state budget. Or maybe it's something like having a senator introduce a resolution declaring the importance of continuing to fund cancer research. Legislative advocacy takes various forms, and ultimately, most advancements, both big and small, in the efforts to improve cancer care have started with legislative advocacy. Now, given today's national audience, I'm going to spend a bulk of the webinar focusing on federal information, but it's of course helpful to just remember that we have elected officials at every level of the government, some of whom have a really significant amount of impact on how things work in our day-to-day lives. So of course, at the federal level, you have the president as the leader of the executive branch. In the legislature, there's 2 senators in every single state. And then there are US representatives. The number of representatives each state has is based on each state's population. Of course, you have similar roles in the state level. So the names of positions do vary from state to state, but all states are going to have a governor and some form of legislative body. So for example, in California, the legislators are called state senators and assembly members. But you also have representatives at the local level. And again, the names might differ, but generally the head of the city is going to be the mayor, and then there's going to be board of supervisors, city council members, school board, etc. So how would you actually go about finding those elected officials? Lots of different ways to do that. So we have information on triagecancer.org on our advocacy page, but then there are some really useful search tools. I happen to really like the commoncause.org site. It is a nonpartisan site, but they have a tool where if you put in your mailing address, it will show you your elected officials from the president on down to your city representatives. So it's one place where you can go to find all of those elected officials. But also if you were looking specifically for your member of Congress or your senators, House.gov and Senate.gov have a similar type of tool. State legislatures often have a similar tool on their websites, and you can find the links to each state legislature on those state resources pages that shall be shared with you earlier today. Again, I realize that for some of you, this information might be repetitive or old news, but studies have shown that many Americans don't have a strong grasp on exactly how our system of government works. So I'm going to spend the next few minutes level setting and making sure that we are all on the same page before getting into some specifics around advocacy opportunities and some tips and tricks. In the United States, we have a system of checks and balances. And essentially what this comes down to is it's like a game where no one player gets to make all the rules or have all the power, but that it's split into 3 equal branches of government. So we have the legislative branch, otherwise known as Congress, that's responsible for making the laws. Then there's the executive branch, led by the president, who's responsible for enforcing the laws. And then we have the judiciary, or the judicial branch, which are the courts. And their responsibility is to interpret the laws. So each branch has a way to check or limit the power of the other one. So no one branch becomes too strong. So, for example, Congress can make a law, but the president can veto it. And while the president might be in charge of the executive, Congress can override that veto to approve or reject presidential decisions. And the courts at the end of the day are the final say in whether or not a law or action complies with the Constitution or is unconstitutional. So the goal in this system is to make sure, again, there's balance between the branches and that no one branch can take over. So starting with the branch that makes the laws, the legislative branch, again, more commonly referred to as Congress. Congress has two houses, the Senate and the House of Representatives. The makeup of both chambers changes with every federal election. So whichever party has the most number of members or elected officials is what's referred to as the majority. The other party is referred to as the minority. When there are other parties, like independents, for example, each independent member of Congress gets to decide which party they're going to caucus with, which just means which party they're going to kind of meet with and discuss and plan their strategies with. This is the current makeup of Congress. So Republicans have the majority in both houses. There are currently 2 open seats. Both are in Florida. And Florida has a Republican governor who gets to fill those seats until the next election. So I bring this up just to kind of share that the chances are the final count in the House of Representatives is going to be Republicans at 220 and Democrats at 215. Each member of Congress has a 2-year term. Senators have a 6-year term. Now, when we talk about members of Congress, there are some terms that get thrown around that may not be familiar to you. And the first is the district. So every state is broken up into districts, and the number of districts depends on the size of the state and the population. And so I've given you a map here of Illinois where you can see the various districts laid out, and where there are fewer districts where there's fewer, or excuse me, yes, there's fewer districts where there's fewer people, whereas up in Chicago, you have lots of districts because it is more populated. Each district is represented by a legislator. If you reside in that district, you are that member of Congress's constituent. And that's a really important thing for you to communicate when you're communicating with your elected officials. And generally, when we refer to member, we're talking about a member of Congress. Now, for terms that are related to legislation, depending on where we are in the legislative process, it could be titled something different. For example, when we talk about a bill, that's a proposed law, something that's been introduced into a session of Congress for consideration. And those proposed laws get a title and a number. When we're talking about bills in the House of Representatives, it will always start with HR. When we're talking about bills in the Senate, it will always start with S. Once a bill is passed and signed by the president, now we're talking about a public law or an act. So it is important to call it the right thing depending on where it is in the process. Congressional committees are like smaller teams within Congress that focus on specific topics like education or defense or the judiciary. And the main purpose of each committee is to study and refine bills. So they'll actually have specific pieces of legislation, and they'll do what's called a markup, where they amend it and change it and make it hopefully better. Sometimes they hold hearings where they bring in experts, where the members of the committees can ask questions of these experts and get additional information and background so that they can make an informed decision about a particular issue or piece of legislation. There are different types of committees that do different things. So there's standing committees, which are sort of permanent things. There's select, where it might be that they're created to investigate a specific issue. Sometimes there's joint committees where members of both houses work together. And within committees, the leadership has a chairman who is an appointed member of the majority party. And then you have a ranking member who is an appointed member of the minority party. So chairman and ranking member. There are 24 current Senate committees. Again, each committee deals with different things. Some of the committees that deal with issues most relevant to the cancer community are the Appropriations Committee, Finance, and Health, Education, and Labor and Pensions, otherwise known as the HELP Committee. In the House, there are 26 committees. And again, they're called different things, but the ones that have the jurisdiction and deal with things that we are most often talking about in the cancer community would be appropriations or ways and means, energy and commerce. And I bring this up just because to the average person, it might not make sense that energy and commerce is an issue that would deal with or is a committee that would deal with issues that would impact the cancer community. So sometimes you kind of do have to hunt and peck to figure out which committee would have jurisdiction. In the United States, the legal authority for all laws ultimately is supposed to derive from the Constitution. So the Constitution is supposed to serve as the foundation, while all these other sources provide the details around implementation. So when a law goes through the congressional process and it's passed by Congress and signed into law by the president, then it's codified into the US Code or USC. So that's sort of the whole clearinghouse for all of current US law. Then there's federal regulations that get put in the Code of Federal Regulations. And these are the rules and regulations that federal agencies implement and then enforce. Executive orders are directives issued by the President of the United States designed to manage the operations of the federal government. Similarly, presidential memoranda are very similar to executive orders, but they're directives from the president, usually focused on specific government operations or policies. Then there are going to be rulings by federal courts in cases involving interpretation and application of federal laws and regulations. And their ultimate decisions establish legal precedents that are supposed to guide future legal decisions. And of course, we have all the same types of legal authority at the state level as well. Now, executive orders is something that we've heard in the news, I think, more often in the last couple of weeks than we have in the past. And ultimately, an executive order stems from Article 2 of the Constitution that says the president gets the executive power over the government, including the obligation to take care that the laws are faithfully executed. So even though the Constitution doesn't actually even mention executive orders or presidential memoranda, they are used pretty frequently by presidents of both parties to achieve policy goals, set standards for managing the branch, outlining policies. So there's a long history of using executive orders. And if they are based in the Constitution and on appropriate legal authority, executive orders do have the full force and effect of law. And I got to tell you, looking at the history of executive orders, many of them have done some very mundane things, like asking agencies to investigate if they can streamline customer services. Others, though, have monumental significance to our country. And a great example of that is the Emancipation Proclamation that President Lincoln signed during the Civil War. That was an executive order. So executive orders really run the spectrum of significance. At their core, what they do is tell federal agencies how to implement a statute. What they cannot do is override federal laws that are passed by Congress. Even if an executive order is issued, they can be reversed, and there are a couple different ways they can be reversed. Congress can act where they actually pass a law to reverse the executive order. A court might hold that an executive order is unlawful if it violates the Constitution or some other federal statute. And the next president can always issue a new executive order to rescind or amend a prior executive order. So even though they hold the full weight of law, it doesn't mean that they're written in stone. I know that many of us have gone to high school and gone through high school civics, but I do also think that there's sometimes some confusion about the exact process of how a bill becomes a law in the United States. And I want to note that bills can start in either the House or the Senate. But for my example and sake of ease, we're going to just assume that this bill that we're talking about is introduced in the House. So a bill is introduced by a member of the House of Representatives. It's assigned a number, HR 123. It's then referred to the appropriate committee by the Speaker of the House. So based on the jurisdiction and where the Speaker thinks that bill should be referred. The committee then can hold hearings, gather information. They can do that markup session I mentioned where amendments or changes can be made to the bill. And then after deliberations, that committee votes. If passed out of committee, then the bill is eligible for a floor vote. To pass the House, a simple majority of those present and voting is required. So if all 435 members of Congress were present and voting, you would need 218 to pass the bill. Once it's passed out of the House, then it gets sent to the Senate, where it undergoes a very similar process. It gets referred to a committee, the Senate committee can hold hearings, markup, etc., and then it can go to the floor. This is where it gets a little bit more complicated. To pass a bill, a simple majority is all that's needed. So in the Senate, that's 51 senators if all 100 were present. And if there was a tie, the vice president is the tiebreaker. Where, again, this gets a little bit complicated is that in order to vote on a bill, first debate has to be ended. And in order to end debates, there has to be what's called a cloture motion. And once a motion is called for or is made, in order for it to pass, they need 60 votes to end debate and vote. So if they can't get the 60 votes to end debate, then they never get to vote on the actual bill that only needs the simple majority. And this was really designed to ensure that a close majority couldn't move things forward without a supermajority of the Senate. So that's where we get the filibuster and cloture and supermajority and 60 votes. So it does get, not supermajority, excuse me, 60 votes, and it does get a little bit more complicated. If, however, it gets passed on final vote by simple majority, then it goes to the president. The president has 10 days to either sign the bill or veto it. If the president vetoes the bill, then it goes back to Congress, and Congress has the opportunity to override the veto. And that's when you need the supermajority. So this all means that even with a simple majority in the Senate, there does have to be across the aisle communication, or that was the whole goal in setting up this system. But there is a system that has been used increasingly over the last couple of years to get around that procedure. So under the Congressional Budget Impoundment and Control Act, excuse me, the House and the Senate are required to adopt at least one budget resolution every single year. So that is a legal requirement. But this is a resolution that's kind of like an internal memo. It's never really sent to the president for approval or veto, but it just serves as like a blueprint for what the Congress should be spending money on. And so once the budget resolution is put forward, then the information goes to the committees. And the committees then hammer out the details of how to implement the budget resolution. Once all of those individual bills from the committees come together, then it gets combined into one big bill known as an omnibus. That big bill then gets sent to the full chamber for debate. Once it's debated and both houses pass it, then the House and the Senate work together, try to resolve the differences. It gets sent to the president, who either enacts it or vetoes it. So not totally dissimilar to what I just talked about, but there's one very significant difference when we talk about the budget reconciliation process. And that is because while normally the Senate needs at least 60 votes to end debate, the Senate has a 20-hour debate limit for reconciliation debates. So essentially what that means is it just ends after 20 hours. So there's no cloture vote, which means you just need a simple majority to move the process forward. So it's like a fast track process that Congress can use to change spending and tax laws without as much debate, with fewer votes needed to move it forward. So that could be bad, that could be good, depending on, I guess, what's considered in the reconciliation process. I think this is something that gets thrown around a lot, especially on the news, and people often don't stop to explain why it's so significant. Now, if you are interested in engaging in legislative advocacy, and presumably you wouldn't be spending 90 minutes with me today if you weren't, Congress.gov is a really useful tool for you to know about. So it is the clearinghouse for information coming out of Congress. It includes information about pending bills, committee reports, the congressional record. Very useful tool. There is a search bar at the top where you can start to search for what you're looking for. And then there are also some ways that you can narrow down the information. So here you can see I've refined my search by a search term. I only want to look at legislation, and I only want to look at the current Congress, which is the 119th Congress. So I'm looking at specific bills to what I searched for that are currently pending. Then if I find something I'm interested in learning a little bit more about, I can actually click on the bill number. And when I do that, more information shows up. So here I can, sorry, my circle's off, but I can get alerts about whenever something happens to this particular piece of legislation. So when you sign up for a free account and you click get alerts, if something happens, like a hearing is called, or it passes out of committee, or it gets passed out of the House, then you get an email alert. So it's a great way to stay up to date with what's happening. You can also see some information about the details, like who sponsored the bill, what committee was it referred to, and then what was the latest action. So here, it's a relatively new bill. Congress is still pretty new. All that's happened so far is that it was referred to the committee. And then I can actually see a quick summary of what this bill does. I can also click in and see the specific text of the bill, so I can read it myself. And then I can look at more details about if there's been a lot of different actions. I can see the whole running history in that actions tab. For some bills, there's also some additional information, like a CBO cost estimate. So the Congressional Budget Office, or the CBO, might do something called scoring the bill. And so that is their estimate about, if the bill were enacted, what kind of financial or fiscal impact would it have on the federal budget? So once there is a CBO cost estimate, that would be available for you there. Now, one of the really helpful things when you're thinking about engaging in advocacy is understanding who's supporting or opposing a particular piece of legislation. And one way to know if someone is supporting it is to see who the co-sponsors are. So while bills ultimately have a single sponsor, sometimes one in the House and one in the Senate, there can be others that aren't the original sponsor or aren't the head sponsor, but that are co-sponsoring. And this is a way for members before a vote to indicate that they support a particular piece of legislation. So I think this is super helpful when you're thinking about communicating with your elected official about a particular issue. Check, are they already a co-sponsor? If not, maybe that's something that you can ask them to do. If they are already a co-sponsor, maybe that's something that you can thank them for in their support. Once you click on this too, you can also narrow down the information. So show me, all of the Republicans or the Democrats who sponsored this bill. You're only seeing Democrat right now because apparently only Democrats have co-sponsored this bill. But you can also narrow it down by state. And again, this can be helpful because if you're in a state like, I don't know, Illinois, like I am, maybe I want to see, okay, who from Illinois sponsored this? And when I talk to my elected official, maybe I want to say, your 3 other colleagues from the same state have sponsored this, right? Because that sometimes is how they move things forward. So switching gears to the executive branch. Of course, it's led by the president, who, among other things, oversees federal agencies. Federal agencies are part of the government that carry out the laws and manage various services for the country. They generally focus on specific areas like health, defense, transportation, labor, taxes. And there are 3 kind of main types of agencies. There's executive agencies that are going to help presidents enforce the laws, like Department of Labor or the EPA. There's regulatory agencies which make and enforce rules for industries, like the Food and Drug Administration or the SEC. Then there are some government corporations, and perhaps the most well-known is the US Postal Service. So again, the idea behind these agencies is to run programs, enforce laws, serve the public, handle tasks, ultimately with the goal, hopefully, to be efficient and make sure that the rules are being followed. One of the ways that they do that is by issuing rules. In our system, the laws that are passed by Congress often only provide the framework or the blueprint for how a program or benefit is supposed to work. And it's the agencies that end up giving us the details, and the place they give us the details is in these rules. So when a law is passed and an agency then starts to create rules, the first thing they do is issue an interim rule with a request for comments. So who comments on rules? Well, it can pretty much be anyone. Individuals can comment, organizations, companies, coalitions, task forces, almost anyone can comment on a regulation. And those comments are a way to express perhaps support or opposition, or ask questions, or provide recommendations. And historically, really, the entities that were commenting on regulations were generally like professional associations, like ASCO, for example, or law firms and policy shops, or again, sort of organized coalitions around issues. Interestingly enough, over the years, that's changed. I mean, certainly all those entities still comment on regulations, but there's also an increasing number of individual comments as well. And part of that, I think, is because a new system was implemented on regulations.gov, where essentially, if you can post on Facebook or Twitter or Blue Sky, you can comment on a regulation. You go to regulations.gov, you search for the regulation that you're interested in commenting on, and then you type your comment. And to try to illustrate just what I mean, I just pulled a screenshot from an open comment right now around access to telehealth. And this was the comment, 2 sentences. This will impact patients. It provides flexibility. Oh, sorry, 3 sentences. In person doesn't change the quality of care, right? Like, this was the person's comment. The point, though, is that this perspective is really important for agencies to see, to hear, to understand, because if they are only hearing from the special interest groups, then they might be missing out on the perspective of the people who these regulations are often going to impact the most. So I really encourage you not to be, I don't know if intimidated is the right word, but to not think that commenting on regulations isn't something that you as an individual could do, regardless of your role in coming today, whether you're an individual who's been diagnosed or a caregiver or an advocacy partner of ours or a healthcare professional. All of your perspectives are really valuable, and agencies should be hearing those perspectives. Moving on to our, final branch of government, the judiciary. Of course, sitting at the top of the judiciary is the Supreme Court of the United States, and their primary purpose is to ensure that there is uniform interpretation and application of laws across the United States. So generally, what this means is that as a legal issue is brought to courts, it's typically brought in lower courts. And that doesn't mean, lower as in worse. It just means in the chain of command, so to speak. So generally, if a court case is decided at a state Supreme Court or at a district court, you might have 2 state Supreme Courts interpret the same law differently. Or you might have 2 district courts interpret the same law differently. And when there is that conflict of law, then it goes up to the Supreme Court, where the Supreme Court makes the final decision. There are, at the moment, 9 justices, with a chief justice sitting in the middle and 8 associate justices. That number over the history of the United States has changed, but currently that's where we are. So with that, I'm going to just take a quick moment to take a look at the Q&A to see if there are any questions that I can address right now. So that's okay, so there is a question about, are there particular types of legislation that are more or less likely to be included in a budget reconciliation bill? And absolutely there are. So budget reconciliation bills are actually limited in terms of what can get included in them. And there is a rule known as the Byrd Rule. And what that means is that if a change that is being proposed in a budget reconciliation doesn't impact the budget in a really significant way, then it shouldn't be included. So there are lots of things that tangentially could be attached to the concepts of spending and tax and debt. But the Byrd Rule says in order to be considered in a reconciliation, it has to have a significant impact on the budget. Thank you for that question. Okay, so I'm going to, most of these questions I think I'm going to get to in the next couple of slides, but keep them coming. I will certainly do my best to answer all of them with the time that we have today. Given that we now, hopefully, are all on the same page with respect to how our system works and the various ways that legal authority can come down, I want to talk about some specifics specific areas of the law that are ripe for advocacy opportunities. I do have to start with some opportunities that are ongoing. These are things that we have been working towards for many, many years, but they're still opportunities because they haven't been completely resolved, like a federal standard for paid sick leave, expanding the FMLA, whether that's, increasing or decreasing the eligibility requirements so that more people have access to the FMLA, expanding the definition of family so that more family members might be able to act as caregivers, etc. There's lots of ways that the FMLA could perhaps be improved to benefit the cancer community. Similarly, given that the FMLA is unpaid job protected leave, there are some opportunities to work towards making that paid medical leave or family leave. Certainly, the cancer community is significantly impacted by the waiting periods that exist with Social Security disability insurance, both the 5-month waiting period before benefits can begin and the 24-month waiting period before someone has access to Medicare. So I didn't want to just talk about things that have come up in the last few weeks without kind of reminding everyone that these efforts are ongoing and still require strong advocacy work. But there are some things that have definitely come up in the last couple of weeks that we wanted to address. And some of those things are going to impact Medicaid. Medicaid is, of course, the federal health insurance program for individuals with lower incomes. And what's interesting about Medicaid is that while it is a federal program, it is administered or run by the states. And so states are allowed to have some flexibility in how they design their programs. And the way that they do that is by asking the federal government for something called a waiver. Now, last week, a budget resolution was submitted that called for $880 billion in cuts. And those cuts were to Medicaid. And essentially, it's going to help pay for extending some tax cuts that were originally created in 2017 through the Tax Cuts and Jobs Act. So this is a budget that President Trump yesterday publicly endorsed. So when we stop and think about, okay, well, how are we going to limit $880 billion in Medicaid? It's going to probably require a number of different things to happen, ultimately culminating in the idea that we're going to have to limit Medicaid enrollment to save the money. So how could we do that? States could apply for waivers that would convert the programs into something called a block grant. Now, block grants, we talk about it as if it's one thing, but they could actually take different forms. So some would give states maybe a fixed dollar amount for the entire Medicaid program. And that's all the money they're going to get, regardless of how many people are enrolled. Some states are going to cap the amount that each state gets on a per person basis. So the fund could grow if enrollment grew, but it could potentially limit the services somebody would get because the funds wouldn't be there. Other ideas have been around trying to repeal the Affordable Care Act's Medicaid expansion. So that refers to the new opportunity for individuals to access Medicaid just based on having a low income. Other ways that we could limit enrollment include adding work requirements, allowing states to charge premiums, or disenrolling people for not paying their premiums. So we don't 100% know exactly what Congress is going to do yet, because remember, the budget is just the blueprint. So now it goes to the committees to hammer out the details. Oftentimes, I think we hear about certain policy ideas, and they're talked about very big picture. And work requirements, I think, is one of those. Frankly, for many people, on their face, the idea of requiring someone who is able to work does not sound like a bad idea. However, based on states that have implemented work requirements in the past, the data is showing that the cost to administer the work requirement is actually more than it would have been to just provide someone the health insurance. So I think what that shows us is that work requirements aren't actually going to end up saving the state money. And this isn't just in the abstract. In just the last couple of weeks, Georgia has shared data about their work requirement that they had previously instituted. And it turns out that it did not end up working out the way that they had hoped it would. So I think it is important that we don't just talk about things generally, but we look at the data to see whether or not it is actually the changes are actually going to achieve the desired outcome. Other places where there could be savings is cutting benefits to the Children's Health Insurance Program, otherwise known as CHIP, which provides health coverage for 7.2 million kids. Also, the budget resolution includes some pretty significant cuts to SNAP benefits, which is the supplemental nutrition program previously referred to as food stamps. So overall, we are still waiting for details, but these are some possibilities that we could see coming down the pike. Now, you might be thinking, I don't have Medicaid. So do these cuts matter to me? Will these cuts actually impact me? And the fact is, Medicaid not only covers some of our most vulnerable populations like children and seniors, and certainly people with disabilities like cancer, it also has a really significant financial impact on the state that most people don't realize. For example, if someone doesn't have access to health insurance coverage because they can't get Medicaid in their state and they can't afford to buy a policy, and they go to the hospital because they need emergency medical care, and then they aren't able to pay for that care, the hospital often ends up footing the bill. And that's referred to as uncompensated care. And when hospitals face high rates of uncompensated care, they can't afford to keep that going. So they'll often close the most expensive departments, like the emergency department. Or sometimes they close the whole hospital. And we've seen since 2010, more than 100 rural hospitals close across the country because of this problem. So when we think about this, even if you have the best insurance through maybe an employer that you purchased yourself and you have an emergency and you are in one of those places that had to close their emergency department, that impacts you. We also know that in states that have expanded Medicaid, health insurance premiums in the marketplace for everybody went down. So I bring this up because sometimes we think about these policy decisions in a vacuum without always looking at that domino effect that they could have on other aspects of the healthcare system. So speaking of individual insurance, the Affordable Care Act, passed in 2010, created state health insurance marketplaces. And this was a way for individuals to purchase individual health insurance. And there were some added benefits to purchasing through the marketplace, including financial assistance. Now, in 2001, the American Rescue Plan Act was passed, and it was a COVID-related spending bill. And in the American Rescue Plan Act, additional or enhanced subsidies were included. Those subsidies were really designed in the middle of a pandemic to help individuals access health insurance. Now, following the American Rescue Plan Act, the Inflation Reduction Act was passed, and it did lots of different things, including extending those enhanced premium subsidies through the end of 2025. If Congress doesn't act, those subsidies or financial assistance will end at the end of this year, which is pretty significant from a cancer community advocacy perspective, because we, of course, want to make sure that individuals have access to affordable, quality healthcare. And a study looked at the cost of the marketplace plans and found that if people didn't have the enhanced or extended financial assistance, they would have paid an average of 93% more for their health insurance last year. That is an astronomical increase that people are facing come 2026. And the unfortunate reality is that many people aren't going to be able to afford that 93% increase in their monthly premiums. And the Congressional Budget Office actually has projected that in the very first year of not having these enhanced tax credits, 2.2 million people are going to lose coverage. And over time, up to 3.8 million people will lose coverage. So this is pretty significant from the perspective of trying to keep people insured. There is currently a bill pending called the Healthcare Affordability Act. This bill would permanently extend those enhanced premium tax credits, and it was recently introduced by a number of Democratic members of Congress. Now, there are some other avenues which we as healthcare consumers are protected. However, having the law isn't enough to actually provide the protection, because if all we needed were laws, we wouldn't need lawyers and we wouldn't need law enforcement. So the rules need to actually be enforced, and the place or the branch that is supposed to enforce those rules is the executive branch. And so some specific examples that might impact the cancer community are around copay accumulators. So this is where insurance companies don't count financial assistance like a copay card or pharmaceutical assistance towards someone's out-of-pocket maximum, which then ultimately can increase the amount that consumers end up paying for their healthcare. In 2021, the Trump administration issued a rule that allowed for copay accumulators. It didn't require it, but it just said insurance companies can have these. In 2023, the US District Court for the District of Columbia struck down that 2021 rule, saying that private health plans can't use copay accumulators for brand name medications that don't have a medically appropriate generic. So if there's no generic and someone is getting help to purchase their brand name drug, that help has to count towards their out-of-pocket maximum. However, Health and Human Services under the Biden administration said they weren't going to enforce that court ruling, but that they would create a new rule. Unfortunately, that never happened. And so it's unclear if Health and Human Services under the Trump administration is going to enforce the court ruling or issue a new rule that frankly would contradict with their original one. So unfortunately, copay accumulators may continue to exist. Another issue could be around a recent rule that the Consumer Financial Protection Bureau finalized. So this rule, otherwise known as the medical debt rule, was issued on January 7th of this year, and it was designed to stop credit reporting companies from reporting medical debts to lenders and prohibiting lenders from making lending decisions based on existing medical debt. So this is pretty significant from the perspective of the cancer community and addressing the overarching impact that financial toxicity and medical debt can have on people. So this final rule was supposed to go into effect on March 17th of 2025, but the rule was challenged in court. The Consumer Financial Protection Bureau was defending the rule in court under the Biden administration. So they went to court to defend this rule. But the new acting director of the CFPB ordered that all work was to stop at the entire agency. All work was to stop at the entire agency, including defending this rule in court. on February 5th, they actually went into court with another case and said push back the effective rule date by 90 days. So not only we don't have the decision yet in that case, but it is potentially not going to go into effect on March 17th, and the court might rule that they get to push it back 90 days. Again, we have a lot of unknowns here. And when you go to the official website for the Consumer Financial Protection Bureau, the homepage is currently showing a page not found error. Stay tuned. Another place where there are some potential advocacy opportunities is in issues around Medicare. So to date, as of today, 54 bills have been introduced in this new Congress with the word Medicare in the title. Some of these could have a really significant impact to the Medicare program, which of course is the federal program, health insurance program that covers people over the age of 65 and individuals under 65 who have been receiving SSDI for 2 years or end-stage renal disease or ALS. Now, some of these proposed changes could be really beneficial to the cancer community. For example, there are bills to include coverage for the multi-cancer early detection screening test and coverage for lung cancer screening. There's a bill introduced that would most likely expand guaranteed issue rights to purchase Medigap, otherwise known as Medicare supplemental health insurance. The reason I say most likely is because some of these bills were introduced so recently that the actual text of the bill isn't available yet. So I'm basing some of these statements about what these bills would do based off versions of the bills that were introduced in prior Congresses. So we are still waiting for final language or final introductory language for some of these things. But one bill we do have the text for is HR 191, Inflation Reduction Act of 2025. And this is essentially a one-sentence bill that says, repeal the Inflation Reduction Act. For those of you that might not be familiar, the Inflation Reduction Act is that 2022 law that did a number of things across sections. I've already discussed the additional financial assistance it provided in the marketplace, but it did some pretty significant things in Medicare as well, including adding for the first time an out-of-pocket maximum on prescription drugs in Part D plans. So for the first time in about 20 years since Part D was signed into law, there was an out-of-pocket maximum. This year, we saw the biggest changes in that out-of-pocket maximum went down to $2,000. And not only is that the most that someone can pay out of pocket for their prescription drugs, there's an additional opportunity for them to enroll in a payment plan where they can spread out that $2,000 across the year. These were game-changing changes. Of course, they've only been in effect for 2 months, so we still don't see the full ramification of it. But if HR 191 passes, those things go away, and we go back to 2023's version of Part D coverage. Now, there are some other things that have been thrown around that we've seen in prior budgets that we don't have existing legislation on. Again, we just got the budget resolution, so we don't know what's going to come out of committee yet. But some of the things include moving Medicare further towards privatization. And what that means is having Medicare Advantage plans be the only option and eliminating the option for original Medicare. Again, from a cancer community advocacy perspective, there are some concerns given the challenges that many people have with Medicare Advantage's sometimes limited provider pools and their prior authorization practices. But interestingly enough, the data shows that this may not even save money based on the fact that an independent congressional agency. So it's the Medicare Payment Advisory Commission, or MedPAC. Again, independent congressional agency that is designed to advise Congress on issues around Medicare. They recently found that in just 2024, Medicare ended up paying Medicare Advantage plans $83 billion more than it would have cost the government just to have those people in original Medicare. So again, sometimes privatization and efficiency sound like good words, but will they actually end up in reduced costs, and will they actually end up in improved care is questionable. Other things that have come up are a voucher system where Medicare would provide enrollees a voucher for a specific amount of money, and then those enrollees could use that money to then go buy insurance on their own. Other cost-saving measures have included increasing the age of eligibility for Medicare. So currently it is 65. There have been proposals to raise it to 67. And last budget, there was a proposal to raise it to 69. So again, we don't have all the details, but these are some possibilities that we are going to be keeping an eye out for. Now, we're also seeing some changes in the agencies that we talk about in like every single day in the cancer community, who have varied functions, like the National Institutes of Health. It's responsible for clinical trials, and the CDC prevention and control, and the FDA, which approves new drugs and tests and devices and ongoing safety of previously approved things, and the National Cancer Institute, the Department of Labor. So again, we don't know all the specifics yet, but these are places where we need to, where we are going to be keeping an eye out for. And of course, as I mentioned at the beginning, this isn't just advocacy at the legislative level, isn't just happening at the federal level. There are also some state opportunities, and here are just a few of the current examples. There are some opportunities around Medicaid expansion, and certainly that could be about getting new states to expand, but it might also be about advocating that states don't eliminate Medicaid expansion. So there are some states who have previously expanded that are now considering going backwards. So I'm going to talk about where you can find more information about both federal and state legislative opportunities in just a minute. But I want to talk about some tips and tricks about how to actually be a legislative advocate. And for some people, it does feel overwhelming to get involved. There are some organized advocacy efforts. Some of these are run by cancer community entities like the American Cancer Society's Cancer Action Network or the Cancer Support Community. Some are specific to a type of cancer, like Komen, for example, but some are also not cancer specific, like efforts to make sure that all copays count, who are advocating against copay accumulators, for example. There are ways that you can get involved on your own, but believe it or not, the single most effective thing that someone can do to be a legislative advocate is also the easiest, and that's to vote. Because if you don't vote, you don't get to complain, at least to me. And I realize that this sounds a little bit harsh, but it's probably one of the most honest things I could say to you about advocacy. In this country, we are so fortunate to have a say in who our elected officials are. We should be using that voice, and your story is important and your vote is important as well. And it's not just important every 4 years. We have midterm elections we have midterm elections coming up in 2026. And just in the next election, 33 Senate seats, all 435 seats in the House of Representatives, and 36 governorships will be up for re-election. So there is certainly an opportunity, if your current elected officials are not voting, supporting, engaging in the way that you want them to, you have the ability to make that known at the ballot box. In addition to federal and state elections, many state, county, or city elections also include elections for judges. And this can be kind of tricky. It is also tricky for myself because you may not know who the judges are. You may not have ever heard that person's name or had any sort of interaction with them whatsoever. So how can you possibly become an informed voter about these judges? There are entities that provide recommendations or endorsements. And so maybe it's about a bar association, which are associations of lawyers. If you are a member of a political party, there might be a state or county party that provides guidance. I would also suggest looking to nonprofit and advocacy groups. So many of those entities that have those organized efforts also will put out voting recommendations or voting guides to help you learn more about the judges and how they have previously ruled and how that could or could not impact the causes that you care about. Now, assuming that some of the things that I've talked about today are things that you care about and want to get engaged with, how do you actually communicate with your elected officials? You can literally call, phone, fax, email, write a handwritten letter, meet elected officials. There are lots of ways to engage with elected officials. I don't think one is necessarily better than the other, provided you follow some of the tips I'm about to provide you with. But I do also think it's important to remember that all of your elected officials, even at the federal level, have district offices. So in your physical location, they have an office. And many times elected officials are out at community events. So for example, it's not uncommon for my state senator to participate in my local St. Patrick's Day parade. And that's an opportunity for me to just approach him, say hi, remind him about the work Triage Cancer is doing, say thanks for everything you're doing. It'd be great to set up a meeting to talk. It's just another touch point that is often much less formal than some of these other ways to engage. If you are interested in making phone calls, which of course is one of the most immediate ways to communicate with an elected official, I do think it's really important for everyone to remember who the person is that's answering the phone, especially if you are calling a member of Congress with whom you disagree. Typically, the person who is answering the phone is an unpaid intern, either high school or sometimes even, college or sometimes even high school. They are unpaid interns, or they are members of the staff called staff assistants, who are the youngest, least well-paid members of a staff. So I say all of this that even if you are incredibly displeased and want to express all of that, kindness does go a long way, especially given that the people you are likely communicating with have very little power over what their members of Congress do. But that doesn't mean that what you are expressing isn't important and valuable and you should be expressing it. It's just about remembering who's listening. There is a, I believe, new tool called 5 Calls, and it's an app that you can download. And what's really interesting about this app is that it has a number of issue areas that you can pick from. So it literally says what's important to you. So here I picked save NIH funding. This is important to me. Then it gives me a quick update, background, synopsis of what the issue is that I can read through. Then it shows me the 3 relevant elected officials based on this issue. So for me, it's my 2 Illinois senators and my member of Congress, Congressman Quigley. Then I can click see your script, and it gives me a script that I can use. Now, of course, I don't have to use these exact words, but it is really helpful if you are like, I want to support NIH funding, but I don't know what to say. This can be a great starting point. It also gives you the phone number right there and then that you can click on your phone to make the phone call. So I think that this is a really useful tool for helping people who maybe don't feel as comfortable engaging on all of these issues. I mentioned some staff, and it is helpful to think about the fact that each member of Congress has different staff members that you might want to be talking to depending on what you're talking to them about. So when we talk about congressional staff, again, every office is a little different, but generally there's a chief of staff that sits at the top right underneath the member. There's a scheduler and a communications director. The scheduler is probably the most important person to be nice to next to the staff assistants and interns, because they are really the gatekeeper to the member. And then there is the legislative team, and these are the people who are working on the actual legislation. So there's a legislative director, maybe there's a legislative counsel or legislative aides, and typically legislative aides have a specific portfolio of work they deal with. So in one member of Congress's office, you might be dealing with two different legislative aides, maybe one who deals with workplace employment issues and one who deals with, healthcare issues. And then of course the staff assistants. If a member of Congress is a chairman or ranking member of a committee, in addition to their personal staff, they have committee staff. And again, chief of staff at the top, there's usually a parliamentarian and then the chief counsel with professional members underneath. So sometimes you might be communicating with committee staff not attached to a specific member. And then most members of Congress, every member of Congress, but most elected officials have staff that are in their district specifically. And this could look like a district director. And then they often have staff members who are caseworkers or constituent services. And they can be really helpful for things like VA benefits or immigration issues or tax issues. So if you decide to actually have a meeting with an elected official, it is really helpful, again, to remember, especially if someone's in the minority party, that it can sometimes be a thankless job. And sometimes you might be asked to meet with staff. Please don't be discouraged if you are meeting with staff versus the member, because if you are meeting with them on a substantive issue, typically the staff member is actually the person who has more expertise than the member of Congress. I think it is always helpful to mention a specific bill number if you have it, include an ask. If you are physically meeting with an elected official, keep the group small. Those congressional offices are tiny. It's very awkward to have to meet with big, huge groups. I have had to do meetings in the hallway based on the size of groups. I think it's really helpful to take a leave behind, like a business card, a pamphlet, a brochure, a flyer, something that staff member or member of Congress is going to take back to their desk and potentially look at later. I also think it can be helpful to remember that advocacy is all about relationships. It's a two-way street. And I think it's a nice touch, particularly in the climate that we are in right now, to ask the person that you speak with towards the end of a meeting if there's anything that you can do for them to help them in their efforts. This is not something that a lot of people think to do in this advocacy context, but it can make a big impression with the person you're meeting with. So I said it should include an ask. What are some possible asks? Well, sort of at the top of it is introduce a bill. But even sometimes that might not make the most sense. So could you ask your member to write a dear colleague, for example? And a dear colleague is a specific letter that literally says dear colleague and then gets sent out via a system to every member of Congress. It helps provide context and background on an issue. Maybe you're going to ask someone to support funding, vote yes or no on a judicial hearing. Other ways that you might be able to be helpful to someone, so in terms of asking what you can do for them, can you provide context, tell a story, testify at a hearing, organize a local event, spread the word, be a subject matter resource. So you want to know what it's like to navigate our healthcare system as a cancer patient. Let me tell you all the things that I had to go through and the challenges and problems and potential fixes. Then after a meeting, send a thank you note. And I actually suggest that you send both an email and a hard copy. And here's why. Staffers are busy. They get hundreds of emails a day. They have 8 to 10 meetings in a day. By the end of the day, they may not even remember the meeting they had at 8 o'clock in the morning. So anything that you can do to jog their memory about you, your meeting, your position, your ask is worth it. So in the note, email or hard copy, you can also include additional materials. Maybe they asked a question in the meeting and you now want to follow up on information. So they asked you for, like, I don't know, data or something, or the results of a study. You can send that in your follow-up. The goal here is to thank them, reiterate your position, include contact information for follow-up, be helpful, but don't be overwhelming. So gold star letter, 3 paragraphs. Thank you. I appreciate your support. Here's background material. Here's my contact information. As simple as that. So I recognize that many of us feel like this person. I always say it's an accurate representation of my desk. We're all overwhelmed, not enough time, and now I'm telling you to be a super advocate. I get it. But it doesn't all have to be time-consuming and overwhelming. This is an example of an action alert from the American Cancer Society. So this is an email that arrived in the inbox. It tells a little bit about the situation, and then there is a link to click on. When you click on the link, a form like this opens up where you type your name, address, zip code, and you can click send email. Then the email gets sent to the appropriate elected officials based on your mailing address. Most of us can find time to type in our name and mailing address to send an email. Now, sometimes people will say to me, like, do these calls matter? Does it matter that we're calling if the person disagrees with us? Do these form letters matter? Do they actually have an impact? And believe it or not, they do. And this is just one example from Senator Murkowski, who a few days ago said that, thanks for your phone calls, but we're getting so many of them, it's basically shut down the switchboard office. So we're working through it, but keep them coming. And so I think it just goes to show the impact that even a simple phone call can make. Now, again, you might be thinking, okay, I'm a nurse, I'm a social worker, I'm a survivor. What kind of impact can I actually have? But my answer to you is tons. People often forget that elected officials work for us. And if they aren't making people happy over time, they can lose their jobs. Members of Congress do listen to their constituents, maybe not as fast as we might all want them to, but ultimately they do. So it does require us to continue believing that individuals can make a difference. I would also say that it requires passion and commitment. And again, I don't think you'd be here if you didn't have that. But successful advocates know that in addition to being passionate, they have to be patient and persistent. And this can be really hard, especially it feels like you've done all this work to advance a cause or support an issue or oppose an issue and nothing comes of it. Was all that work worth it? At the end of the day, I'd say patience and persistence are a necessary tool for any advocacy effort because it can often take years talking about an issue before a bill's even written. And then multiple congressional sessions for a bill to get a hearing, let alone a vote. And perhaps my favorite example of this is the late Senator Edward Kennedy worked for healthcare reform for his entire tenure in the US Senate. He first introduced his healthcare reform bill in 1970. And it wasn't until 7 months after his death that the Patient Protection and Affordable Care Act was signed into law. For perspective, he worked through 8 different presidents, 7 terms in Congress, and 40 years to get a bill passed. And it's still not perfect. And keep in mind that expressing your support for a bill, even if it doesn't have a strong chance of passing, is helpful. Legislators use those calls, emails, meetings as a barometer for what their constituents care about. It's also potentially helpful for them externally to be able to say to their colleagues across the aisle, listen, these are some of the things I'm hearing. And the other piece is, even if a bill can't pass standalone by itself, given enough support, maybe it could get included in something bigger. And a good example of that is the recent rule on the cap on insulin costs. That couldn't pass as a standalone bill, but it was eventually added to the Inflation Reduction Act. So I say all of that because even when it feels frustrating, there are still things that we can do. And learning is absolutely required. So I absolutely appreciate you being here today. And I just wanted to share that as things continue to happen, as things change, we at Triage Cancer will be monitoring those things for how they might impact the cancer community and sharing that information on our educational blog. As I mentioned, having a law is probably not sufficient to make sure all the protections exist. Advocacy is, in fact, required to make sure that people know about the laws that get passed as well and how to enforce them. If you are interested in learning more about the federal and state policy and legislative advocacy efforts that we are currently tracking at Triage Cancer, we have those on our advocacy resource hub. And if you are interested in staying up to date, you can actually subscribe to our blog by using this QR code or going to triagecancer.org/blog. And then when we post new blogs, you will get an email with that information. Now, I do have to say, advocacy can be frustrating. Even if you do everything I've talked about and you are the perfect advocate, you may still not get what you want. Roadblocks are common and it can be really frustrating. Look at this little guy. He's got 2-inch legs. How's he ever gonna turn himself over? But this is where perspective comes into play. And I can't say I'm always successful at this, but I do find the more optimistic I can be about things, generally, the better life can be. So I'm certainly not saying we shouldn't get upset or frustrated or hope for better or want to do more. I'm simply saying that I hope the end result of that frustration isn't you quitting in your advocacy efforts. So with that, I know we are close to time. I'm going to turn it back over to Shelby to do some wrap up, and I will do my best to address any questions left in the Q&A. Thank you so much for your time today, and I hope you have found today useful.
Thank you so much, Monica, for that great presentation. We are answering some of your questions that are left on the Q&A box, so please bear with us. If you enjoyed today's webinar series, we invite you to attend the rest of our series. You can see the full schedule at triagecancer.org/webinars, and we also post recordings of all of our webinars on our past webinars page. Thank you. And our flagship event is our Triage Cancer Conference. This is an educational event open to anyone. We cover topics like advocacy, health insurance, finances, and more. We have our first one in the spring on May 17th and our next one on October 18th. And you can register at triagecancer.org/conferences. For our healthcare professionals on the call, we have 2 trainings for you. We have our insurance and finance intensive. We cover topics like the U.S. healthcare system, Medicare and Medicaid, and more. We have 4 dates in person this year and 4 dates online. And you can register at triagecancer.org/intensive. And it's not too late to register for the March 4th online intensive. And if you're a community health worker, we have a training for you on June 25th. We are going to cover topics like choosing and using health insurance, disability insurance, and more. And then you can register for this on our website as well. And I wanted to remind you before we go about our legal and financial navigation program, where we provide free one-on-one help. And you can just fill out the intake form at triagecancer.org/gethelp. We also have this intake form available in Spanish to get you started. And please stay connected to Triage Cancer. You can attend our webinars, keep up to date with our blog, connect with us on social media. Our handle is at Triage Cancer, and you can order materials and we will ship them to you in bulk and for free if you fill out the material request form on the screen. And lastly, we want to hear from you. So please scan to share your experience or visit triagecancer.org/testimonials. We're always looking for ways to improve our programming, and we want to hear what you have to say. For those of you requesting CEs today, you must have registered online, attended the entire webinar, and you must complete the evaluation and post-test within 1 week. This will be sent to you via email tomorrow, 24 hours following this webinar. For nurses and social workers only, you must receive a passing grade on the post-test of an 80% or higher. So if your screen looks something like this, then you have passed and you are all good to go. But if your screen looks like this, then unfortunately you have not passed and you have one opportunity to retake the post-test. You can copy and paste the post-test link into your web browser and you have one opportunity to take that. All certificates will be sent within 4 weeks to everyone who qualifies. Thank you all so much for being here today, and we will see you at our next webinar.